as I said, that headache is a general symptom, like fever, pain, malaise, body ache. These are all symptoms. They're caused by various factors, So headaches are caused by so many different factors. But the king of all headaches is called migraine. It comes from two words, hemicrania, half the head, cranium, head. So if you have half-sided headaches, which is very intense and it lasts for 2 to 5 days and it's cyclical, it may come just before the periods in women or certain times of the month, twice a month or once a month, once in 3 months, then accompanied by dizziness and photophobia. You can't look into bright light and you can't listen to loud noise. So these people who suffer from migraine, one-sided headaches, they stay in dark rooms. They don't want to see anything. They want to meet anybody. They don't want to talk to anybody. They put a band around their head and they don't eat, and they have frequent vomiting, nausea and vomiting. The body tries to throw away as much fluid as possible to reduce the volume of blood so that there is less headache. So it is like a disease because it's so cyclical. It'll come at a particular time of the month, stay for 3 to 5 days, and then disappear as if nothing had happened. So it's a cyclical disease. I sometimes jokingly say it's like hay fever. When the pollen count is high, you get this sneezing, itchy eyes, and a runny nose, and all sorts of symptoms of fever-like symptoms. And then as soon as the season is over, it's all done. So migraine is a separate category of headaches. All migraines are headaches, but not all headaches are migraine. We have to make this very clear. Because it's a complicated disease, it's the hardest to cure. Migraine is quite hard to cure. But if you carefully plan the protocol of treatment, you can beat this disease as we have done. So what are the elements? You have to prepare for an imminent migraine attack a week before it actually happens. So your diet should be very simple. No coffee, no salt, no sugar, no alcohol, no smoking if possible. And you try and drink lots of water, sleep as much as you can to reduce the stress, and you make sure that you don't expose yourself to late nights, to strain, stress. You're preparing for a big drama which is going to come, okay? And if it's cyclical, it'll come every month. So you're preparing for a big drama, and so you've got to get some sort of balance within the body. What is the type of diet that you should follow? Well, first of all, avoid nuts and all these things, because if you chew a lot, then these joints, they get affected, and they can trigger off a headache. Okay, avoid strong smells, avoid acid products, orange, lemon, grapefruit, pineapple, vinegar, and very, very spicy food like pickles and rich curries. Avoid that. Okay. Make sure that you do not get a lot of gas, avoid yeast altogether, digestive problems. Then make sure that you don't eat too much of cheese and ice creams and all that. They're mucus producing, and they'll produce mucus here, you know. And some of the migraines have, uh, have uh, sort of are accompanied with sinus problems as well. So you have your usual migraine, and when you get sinus, sometimes it is like that. So you avoid these things, and of course, the stimulants, coffee, salt, excess salt. You do that, then during this period, this 7-day period, you may do some breathing exercises, So breathe in, hold your breath, breathe out. So if you take 6 seconds to breathe in, hold your breath for 6 seconds, breathe out for 6 seconds. So basically, your lungs are not active for 18 seconds in a minute. So you breathe with this breathing technique, you breathe 3 times in a minute. 6, 6, 6, that's 18, 3 times. So it's 54 seconds. So you breathe calm. So do this practice for sort of 3 times a day. Practice this breathing. You may also, introduce this retention breath, which is hypercapnic breath, building up the carbon dioxide in blood. So breathe in for 10 seconds, breathe out and breathe in, hold for 10 seconds, breathe out, breathe in, hold for 10 seconds. So you hold your breath for 10 seconds and the body accumulates carbon dioxide, and in response to that, the blood vessels they start to dilate. There's more oxygen in your brain. There's more oxygen in different parts of the body. These are damage control methods. I mean, they may not cure migraine straight away, but these are damage control methods. You do this to make it less intense, to make it tolerable, and then it builds your willpower, confidence that you can do something about it. Because once you get a migraine headache, you're on the floor. So this is a very important thing. What are the things that help? Acupuncture helps you. Number 2, the neck connection massage. So during the month, especially 1 week before before the expected date of headache, you can have a session of neck connection massage. You can watch the video in the app, and the neck connection massage is very useful. The actual massage, the exercises which I've demonstrated there, and of course the relaxation of the breathing. These 3 things are very important, okay? And just when you feel that you have aura, you get this premonition that the migraine attack is coming. Just when you have that, if you can have somebody give you a neck connection massage at home, just relaxing and getting the blood there, and lie down peacefully and maybe take drops of valeriana, which not only slows down the heart rate, but it's a herbal tincture, but also calms you down. So you take about 10 drops in quarter of a glass of water and you drink that. It calms you down, all right? Eat very, very simply, maybe just soups and some juices, okay? and you break the spine of the headache. If you do all these things, the following days, because as I said, the migraine lasts for 3 days, the following days' headaches will be a lot better. So if you do the whole system like this for 7 days a month before the attack and continue this for 6 months or up to a year, you first reduce the intensity of the headache, then it becomes less frequent, and ultimately it will go. But you have to wait that long. It will not. Sometimes with acupuncture, if you are lucky, you can get rid of the headache in in a few sessions. And like you have 7 sessions, once a month or something like that, and you can break the cycle. So migraine is something that you have to take care of. It's one headache with which you have to fight. First do the damage control, and then you actually control the disease. You harness the wild migraine headaches. Linked to migraine is another form of headache which is called the cluster headaches. They come in clusters. They'll start at a particular time in the month. During the years, it starts at 3rd of June and it lasts for 3 months. And it will be always like that every year. 3rd of June for 3 months. For some, it will be 15th of June, but it will always be around the same time and it will last for the same number of days. Very weird. Every day you get these headaches, the migraine with all the nausea and sickness and great distress, and you can't do anything. They give you oxygen to breathe because that's the only way you can make it tolerable. You get all these anti-migraine pills, the drugs that thin the blood so that the blood and the oxygen flows easily through the network of blood vessels and reaches the brain, So it is quite similar to migraine except that it's for longer, and after you've had the seasonal attack, and there's no cluster migraine, you can get headaches. So the treatment is the same as for migraine. You avoid toxicants, but sugar, salt, coffee, you avoid nuts, and then you drink more water, use the neck connection massage, which is demonstrated, and also you can do some self-massage, massage your scalp, massage the jaw, massage the TMJ, here the joint in front of the ears, right? And in sometimes to increase the lymphatic flow in the neck area, you massage the neck, right? And do the breathing exercises, the retention breath. You breathe very slowly and then you hold your breath. So do these breathing exercises and try and sleep as much as you can. So again, try and break the cycle. If you make the headaches more tolerable, less intense, then over a period of time you can cure that. As I said, that they'll disappear when they disappear, suddenly. That is a hard and fast rule. I'm not sure what usually causes these cyclical type of headaches. There are certain cycles that we do not know of. In the body, we have the day-night cycle, we have various types of other cycles going on, menstrual cycle, emotional cycle, and physiological cycle. When you have moments of very high energy, during the month, and you have moments of very low energy. So these cycles are there. They are part of the functioning of the body, probably connected to the planets, the way the planets move, or the connection between seasons. But they they're yet to be analyzed properly. But they are real. They really are serious diseases. Stress headaches are also very, very common. People uh, get worked up, they get very stressed, and they start getting these general headaches. Stress headaches are all over the head. If migraine is half-sided, cluster migraine is half-sided, sinus headaches are focused here, stress headaches are everywhere. So the best thing to do is to try and work on some of the structures that can reduce stress. Number one, you massage the joint TMJ in front of the ears. Massage that for 2 to 3 minutes. Then massage the jaw very deeply. Whenever you're angry, the jaw gets very tight. It's the anger reflex, that we have in the animals to bite. Make sure you massage this for a few minutes. Massage the temples and then massage the shoulder. You can use the systems from the neck connection video, that'll show you how this massage is done, what sort of exercises are recommended, which will help you to get rid of the stress. And there are some breathing exercises which manages the stress. Otherwise, what you have to do is that when you're in a stressful situation and you know that you're going to get very stressed, if you can, close your eyes and then relax the shoulder muscles as if you're trying to let the shoulders drop. Relax. Imagine that the neck muscles are expanding, relaxing. Shoulder muscles are expanding, relaxing. The shoulders. The spinal muscles are expanding and relaxing. Focus on the forehead, between the eyebrows. Imagine that you're looking at a spot. Don't change it. Let the forehead fully relax. Let the crown of your head fully relax. Let your temples relax. Let the occiput or the back of the head relax. Let the neck muscles relax. Breathe in. Hold your breath. Breathe out. Breathe in for 6 seconds. Hold your breath for 6 seconds. Breathe out for 6 seconds. Relax your body. Let all the muscles of the spine and the shoulders and the neck relax, expand, and relax. Imagine that they're feeling warm and quite relaxed. Continue breathing like that. Breathe in for 6 seconds. Hold your breath for 6 seconds. Breathe out for 6 seconds. You're totally relaxing. You're breathing in normal air and you're breathing out warm air. And your internal systems are all relaxing. Breathe in, breathe out. Let your muscles relax, expand, and feel energetic. Focus on this. You can make the head feel lighter. Imagine the pain, the headache is disappearing slowly. You feel so relaxed. You feel so calm. Relax and let the headache go away. You're at peace. There are no worries. And you can cure yourself. You can cure yourself. Open your eyes very slowly. So this way you induce deep calmness and tranquility within your body and your mind, and you'll be able to overcome the stress headache. It's very disturbing, but you can practice this. It works.